Carlo, we all have ups and downs in our life.
Yeah.
And particularly our patients with this kind of disorders, they have a lot of ups and downs and difficult states of mind. And we all learned that states of mind are really important in your theory and methodology. How come this came up so important, so central?
Well, basically, autobiographical memories give you the structure of the patient's discourse and of how their goals are organized. Mental states are a way to describing segments in the stream of consciousness. And states of mind is what patients actually feel and think. And it's a way of describing more the raw experience before it is ordered by the therapist. We are used to give a sense, give a structure, give an order to the patient's discourse, for example, with the ABC technique of cognitive behavioral therapies, or assessing and reformulating and reconstructing the interpersonal schemas. But this is not what the patients do spontaneously. They don't say, well, I have this wish, I want to be respected, and then people used to react. They come to the therapist and they just describe what passes through their mind. And what Marty Horowitz, the psychoanalyst, noted in, it was mid-70s, is that patient's discourse is filled with recurrent aggregates of themes and emotions. Well, in a way, it's
recurrent is the key word here.
Absolutely, it's recurrent because, well, every one of us is experiencing mental states which are context bound. For example, in this moment, we are seeing a beautiful sight of Lisbon, and I've never been here, so I'm sensing a series of experiences, my sight, the wind, my skin, all the atmosphere is great and is unique. This is not recurrent. This is my living experience in the here and now. But, and of course this is healthy in a way, or it's just, reacting to the environment, and it's good. But patients are flooded by things that recur over and over again in their mind, and this is less context dependent. Even minimal triggers can turn on always the same story, always the same pattern of things and thoughts and feelings aggregating themselves, even in somewhat a confused way, and patients cannot make sense of what is happening. Also, they are recurrent, and one typical example of they are also clinically relevant, because the transitions between one mental state and the other is to a certain extent fixed.
Yes.
For example, I can be a person...
From A to B to C.
Exactly. For example, I can be a person with obsessive-compulsive personality disorder. And I have worked a lot, filled with a sense of guilty and responsibility and the idea that I can harm someone else. So I focus my mind on trying to do things at best. I'm very concerned about making mistakes. I doubt about what is the best possible course I can give to my work. And this is the main dominant state of mind. But then it's 7 o'clock p.m. Work is done. The office is closed, and my colleagues are going and let's go and drink a beer all together, which would be fun. So that should require a transition to a different state of mind, filled with relaxation, happiness, laughs, and jokes, and
And that transition becomes very difficult.
As soon as a patient with that disorder starts to experience exactly that state of pleasure and relaxation and sharedness with others, well, that's the trigger for the reinsurgence of the former state of mind. No, I'm relaxing, that's not good. that's immoral.
dangerous.
Yeah, oh my God, maybe I did something bad at work. I'm losing my time. I have to go back home because there is my family. And this is forced. And of course, this is a cause of suffering, not for the state itself. Because
That is what you call a feared mental state?
Hard to say. No, that's not fear. That is desired. The state of relaxation is desired, is inaccessible, because then it leads to a negative state, which is again guilt and responsibility.
That's the guilt that
exactly,
is feared.
exactly. For example, a fear mental state can be, when I enter in a state of dizziness and confusion, then this can be quite dread. And oh my God, what's happening to my mind? I'm scared again. I'm losing the boundaries of my consciousness. Maybe I'm getting mad. This is more a fear state of mind.
Wonderful.
Yeah.
Wonderful. Let's go and hang out a little bit.
Yeah.